Of course, there's a far less negative impact to the microbiome. I mean, these are plants. Your body knows how to assimilate plants in a way that, again, really has very little negative impact to your gut bugs. And there's a lot of clinical overlap with herbs. So a lot of herbs that treat Lyme also happen to treat Bartonella or Babesia. So again, even if you weren't clear exactly which organisms you were dealing with herbs, there's a good chance that we'll cover the base for a lot of these different, infections. And again, it can be very highly tailored to the individual person based on symptoms. It can support the immune function. Very few herbs actually suppress the immune system. And for a lot of people, it can be very cost effective. Even for people who go down the antibiotic route, once you get beyond that, 1 month of antibiotics, sometimes insurance companies start fighting you on whether they would pay for a longer course of antibiotics. And depending on the antibiotic, some of them tend to be very expensive. So for some folks, this is a better financial option. And clinically, they're effective. I mean, I've treated over 8,000 Lyme patients over my now 25-year career, and they work incredibly well. I've probably written 10 prescriptions for antibiotics in my career. So I've rarely found the need to do it. And again, herbs can work incredibly well. Anyone who's under the impression that antibiotics are more effective than herbs really don't understand herbs. And again, this is going to be an option for people who've been down the antibiotic route. Maybe you've tried the antibiotics and it failed. I mean, my own story is, I lived in Connecticut. I'd only been there a very brief period of time, got bit by a tick. I had classic Lyme disease. I went on antibiotics because I knew that's what you did. I went on doxycycline, and within a few days, all my symptoms went away. But I had just started a new business and I was stressed and working long hours. And 8 months later, I started to relapse and got symptoms again. So I went back on antibiotics. It didn't do anything. Changed antibiotics, didn't do anything. Then I started doing combination of antibiotics. I did this for about 9 months and I lost 30 pounds. My gut was a mess. I felt terrible. And I met a doctor, and I'll talk about his protocol in a little bit, Dr. Zhang in New York City, who started treating me with Chinese herbs. And within a month, I felt 85% better. So yeah, this idea that antibiotics don't or are more effective isn't true. And again, you're going to have a lot of people who've been down that route who don't do well. And what's the next option? I've seen people who work with some doctors where they're now on literally their 20th different antibiotic combination, and they're still having the same problems. At what point do you draw a line in the sand and say, hey, look, this isn't working. We need to find a different strategy. So there's a different Dr. Zhang, who's a researcher at Johns Hopkins University, and they've actually been looking at plant extracts and how they work against different microbes. And of course, this is looking at in vitro, so these aren't human studies, but it's good to see under a microscope how these plants can affect Lyme and these co-infections. So the most effective for herbs they found against Borrelia, Cryptolepis, Polygonum, this is Japanese knotweed, Juglans nigra is black walnut, Artemisia annua, this is wormwood, Uncaria tomentosa, this is cat's claw, Cistus, and Scutellaria bicalensis, which is Chinese skullcap. And we'll see as we look at the research on Bartonella, a lot of the same players, as well as Babesia. Again, we see a lot of similar herbs. So I talked about how these herbs overlap and often treat different things. Dr. Lee Cowden, who's a cardiologist out of Texas, who's worked with a company called Nutrimetics and their herbs, and I use a lot of their extracts. He calls a lot of these herbs keep herbs, Keep, and he goes, that kills everything except people. So a lot of these herbs, they're antibacterial, they're antiviral, they're antifungal, they're antiparasitic. So again, often when we're using these plants, we are covering a very broad scope of different microbes that might be overgrown in the body. Let's talk just a little bit about some of these individual herbs. I, of course, don't have time to go through every single one, but these are the ones I tend to use the most. Allicin, this is an extract of Allium sativum, which is garlic. It contains a compound called alitridi. Alitridi gets converted to allicin. So that's that characteristic odor that you smell with garlic. That's the alitridi, the allicin. This is a very well-known antimicrobial. There's actually lots and lots of studies of treating infection. It also helps improve circulation, has mild anti-inflammatory effects. It's best given as time-release caps, so the allicin gets absorbed over a longer period of time. Now, of course, you could add garlic to your diet, adding more garlic, as long as your stomach can handle it. That's a good way to deliver garlic, but we actually use a couple of extracts that are, again, more concentrated than what you would get through garlic bulbs. However, be aware that when you take garlic, either eating garlic or taking it as a capsule, you will excrete this through your skin, you will excrete it through your breath, and you're going to smell like a garlic factory. In fact, when Dr. Zhang first started treating me, he had given me allicin, and I was still seeing patients, and people would walk in. I could see the look on their face, like, "Oh my God, what's that smell?" And I eventually had to stop it because it was offending myself and other people. But just be aware that it's highly effective, but you are going to smell like garlic. You can take a little bit of chlorophyll, which will help mitigate some of that odor. But again, just be aware that garlic will probably make you smell like garlic. Andrographis, this is from Andrographis paniculata. Again, has very broad antimicrobial activity, including parasites. It's a hepatoprotective. It protects your liver. It's an immune modulator. It's anti-inflammatory. It can actually help increase cardiac output. Sometimes that's important for people who have Lyme carditis. Fortunately, again, that's a very rare complication of Lyme, but it can happen. I like a standardized extract that contains 50% andrographilide. This is one of the active components. Andrographis is also a great antiviral herb. Andrographis was actually approved by Thailand as a treatment for COVID-19. So I use it a lot for viral infections, but again, can also be useful in the treatment of Lyme disease. Artemisia, this is an extract of wormwood, Artemisia annua. So with plants, be aware that there are different species of the plant, and you want to make sure you're using the right one. So this is Artemisia annua. There's Artemisia vulgaris. There's Artemisia absinthium. They have different purposes, but we want specifically Artemisia annua. And it contains something called artemisinin. Artemisinin is the compound they think has the antimicrobial activity. They've been using Artemisia to treat malaria for years. It's a weed. It grows everywhere around the world. It's very cheap and ineffective. So anything that works against malaria is highly likely to work against Babesia. Babesia and malaria are basically cousins of each other because they're both blood parasites. So we can use against Babesia. It actually helps suppress autoimmune reactions and has anti-inflammatory effects. So Artemisia actually has research for various autoimmune disease, particularly rheumatoid arthritis, that we can use as a way to help kind of control that inflammation as well. Artemisinin by itself has been associated with causing idiosyncratic liver dysfunction. What that means is that people who took this product started developing liver problems, almost like liver failure. There's 14 cases reported in the literature specific with artemisinin. Now, I don't use artemisinin by itself. I use whole plant Artemisia, and there's no evidence that I'm aware of that whole plant Artemisia causes these liver issues. So if you're taking whole plant Artemisia, I'm not too concerned. There are companies out there that make a pure artemisinin product. I think it's fine if you want to use it, but if you are, you definitely want to check in with your doctor, make sure you get your liver checked periodically, make sure it's not causing any kind of problems. Campsiandra goes by the brand name Banderol. This is the bark of a tree that grows in South America in the Amazon jungle. It, I think, is one of the better broad spectrum herbs against Lyme and co-infections. It's used locally to treat malaria. So again, if they use it to treat malaria, it probably works against Babesia. It's a very potent anti-inflammatory. They use it to treat arthritis and fever. This is one that can cause die-off reactions. Again, with herbs, it's not as common with antibiotics, but I do warn people that you can get a die-off, you can get this Herx reaction, so be prepared, and there's things that we can do to help mitigate that if it does happen. Cat's claw, again, very well-researched herb as treating a lot of different infections. It's got these things called POAs or pentacyclic oxindol alkaloids. This actually helps stimulate the immune system to fight infections. So not only is it targeting the bug, it's getting your immune system to fight it on its own. It also helps reduce inflammation. It protects against oxidative stress. Again, we use it to treating co-infections and really little to no side effects. So I like this herb a lot. I use it as one of my lead herbs with a lot of my Lyme patients just because it's so well tolerated and it works well. Coptis is a plant that they use primarily in Chinese medicine. It's the root called Coptis chinensis. It's rich in compounds called berberine, comptisine, and other alkaloids. Again, very broad antimicrobial activity. They use it in China to treat fungal infections, viral infections, bacterial infections, parasites. These alkaloids do cover a very broad base of microbes. A lot of in vitro studies find it as effective as antibiotics in eradicating a lot of bacterial infections. also good anti-inflammatory. And interestingly, has this effect on the gallbladder, very effective for gallbladder inflammation. So we'll use Coptis for people who just have gallbladder disease, completely unrelated to Lyme disease. Cordyceps is a medicinal mushroom. Cordyceps sinensis. This has been used in traditional Chinese medicine for more than 2,000 years. Very potent immune boosting herb. So again, we're using this as a way to stimulate your immune system to fight the infection on its own. So it contains these things called beta glucans, which increase T helper cells, activate natural killer cells, and macrophages. Macrophages are your tissue cells that fight infection. Helps with circulation, very useful for fatigue, reduces inflammation. It does have a little bit of blood sugar lowering effect. So if you're diabetic or if you have blood sugar issues, just be aware of this could lower your blood sugar. Desmodium, this is a plant that grows in the Amazon. That's called berber. And we use this mostly for detoxification purposes. So I use a lot of berber, often mixed with a different herb called panella. And berber and panella, again, basically are help to get the kidney, get the livers, get the lymphatics moving, flush out of the toxins. So as you're killing off this organism and it's releasing toxins into the blood, this is a way to try and get rid of it more efficiently. This can be really helpful in Herx reactions. So when people are getting a Herx reaction, whether they're on antibiotics or herbs, I'll have them use this every 5 to 10 minutes until they start to feel better. And usually after a day or so of doing that frequency, people feel like they're kind of back to their baseline. Houttuynia cordata. This is another herb that's used mostly in traditional Chinese medicine. Contains a compound called decanoyl acetaldehyde. This is an antibacterial component. This has a very long use of treating leptospira. So leptospira is more common in China than it is in the US. In the US, leptospira can cause meningitis in dogs. Rarely does it cause infection in humans, but leptospira is also a spirochete. So again, anything that kills leptospira is likely to kill Lyme. And again, in vitro studies show it's antibacterial, antifungal, also enhances the immune system, can get rid of swelling and inflammation. It can also help break down biofilm, and I'll talk a little bit about biofilm in a minute. But biofilm is this gunk that surrounds the organism that basically protects it so that the herbs in your immune system can't get to it as easily. Houttuynia has a very short half-life. It's only about 3.5 hours. So this is one you do have to dose a little bit more frequently just to keep the blood levels up. So usually a lot of people do it 3 times a day versus some of the herbs we can get away with just twice a day. Japanese knotweed, again, this is one of the herbs that comes up as being very effective against Lyme, Bartonella, Babesia. It's derived from the root of Polygonum cuspidatum, very broad antimicrobial activity, antivirus, antifungal, also anti-inflammatory, immune modulating, inhibits platelet aggregation. So it keeps your platelets from getting sticky. So we can say very, very mild blood thinner. I don't worry that if you're on this, that you're going to bleed out like you would if you were on Coumadin or heparin or those kind of drugs. Very mild, but because a lot of these infections do tend to make your blood more thick and viscous, anything we can do to kind of thin it out a little bit usually helps. It does have some pain relieving activity, protects your mucous membranes, it stimulates angiogenesis. What that means, it can help stimulate new blood flow to areas. So a lot of times if there's been inflammation damage, one area of blood supply gets choked off, this can kind of help create new roots around that area. Lion's mane is another medicinal mushroom like cordyceps. Can help relieve depression, improves cognitive function. Oh, sorry, my slide got cut off there a little bit with the picture. It actually helps promotes oligodendrocyte maturation and stimulates myelin basic protein and may help remyelating damaged neurons. So again, Lyme can affect the brain, can cause this neuropathy, this brain fog. Lion's mane can help with all of that. Otoba goes by the trade name of Kumanda. This is, again, the bark of a tree that grows in South America. Broad spectrum activity against Lyme and co-infections, anti-inflammatory. Dr. Eva Shapi, who's a researcher at the University of New Haven, basically looked at Kumanda, Banderol, and Cemento. The 3 of those were able to eliminate Borrelia, was more effective against doxycycline and rifampin, conventional antibiotics that are used to treat Lyme. So again, in vitro, the combination of these herbs actually more effective than the antibiotics. And again, in clinical practice, I've used them a lot and they work really well. Pueraria, this is the root of different Pueraria species. This is used to treat high fever, muscle spasms, headaches, stiff joints, diarrhea. This helps a lot with the symptomatic issues of Lyme. Although it doesn't directly kill Lyme, it can be really good to help to mitigate against these other factors that Lyme causes. It also helps improve blood flow to the heart and brain. So again, great for brain fog, poor memory, a lot of these sort of neurocognitive issues that come up. It is anti-inflammatory. Because it can open up the blood vessels, it can have a little bit of a hypotensive effect. So if you've got someone who's already got really low blood pressure, you just got to be a little bit careful with this because it could drop the blood pressure too low. I personally haven't seen that in clinical practice, but it's been reported in the literature that it could happen. So just be aware of it. If your blood pressure is low and you use this, just monitor your blood pressure and make sure it's stable. Why are we? This is Sida Acuta, broad spectrum antimicrobial activity, antipyretic, which means it reduces fever, protects the liver, modulates the immune system, reduces anxiety, reduces pain, and it has kind of a relaxing effect. Stephen Buhner, who's an herbalist who unfortunately passed away in the last couple of years, he's written 2 books on, again, using herbs. This is one of the herbs that he liked a lot and used as part of his protocol. Again, can be incredibly effective. Yellow dye root, again, Cryptolepis sanguinolenta. This is the one that Dr. Zhang and his lab found was again one of the more effective herbs against Lyme and the co-infections. And like all of these, you can see they have a lot of similar effects, right? They reduce inflammation, they kill all the different bugs, they modulate the immune system. This one, again, can lower blood sugar. So again, be careful if you're diabetic. It can raise uric acid. So if you have gout, be careful with that. This is a case where the alcohol extract is actually more effective than the water extract. So when you buy plants, particularly if they're tinctures, they can be extracted in water, extracted in alcohol, extracted in glycerin. And again, sometimes we find one form works better than another. In this case, the alcohol extract is more effective. Other herbs, just to mention, Uncaria rankophylla. I know Stephen Buhner was a big fan of using this for particularly neuroborreliosis, or Lyme was affecting the brain. Chinese skullcap, again, Dr. Zhang found very effective for Lyme, Bartonella babesia. Astragalus is another great herb just to help support the immune system. Hawthorn berry can be very nutritive to particularly the heart and the blood vessels. And Alcornia cordifolia, or Christmas bush, antimicrobial, used for different things, also anti-inflammatory. So as you can see, we've got so many different plants, and there's still some I haven't even mentioned that we can, mix and match. So what's really nice when we start people on herbs is we've got plan A, but we now got plan B, C, D, E, F, and G if we need it. So if we find one combination of herbs doesn't work well, it's very easy to say, okay, let's swap this out. Let's use this instead. And sometimes it's the second or the third, regimen that we use. That's the magic. That's where people really start to feel the shift. And again, in all the years I've been doing this, I've never been able to look at any one person and say, okay, because of your symptoms, these are the herbs that are going to work best. Sometimes I think this is going to work great and it doesn't work very well. We switch the herbs and then we get this great response. I just want to talk about some of the protocols. We talked about kind of individual herbs, and I want to go through kind of some of the common protocols I use. I've outlined all this in my book, The Lyme Solution, if you want more details on it, but let me just kind of walk you through. So the first one is the one that Dr. Cowden developed, and this is just a list of some of the herbs that he works with. So Dr. Cowden, I mentioned, he's a cardiologist. He kind of got into Lyme almost by accident. My recollection is that I think he had treated a family member with Lyme, successful, and really kind of got into it. So he, since then, has really focused a lot on Lyme, and now he's semi-retired. But he found, again, combination of these different products, really was a very broad approach to treating Lyme, because it wasn't just about killing the bug. It's like, well, how do we support people's detoxification pathways? How do we get rid of heavy metals? How do we reduce inflammation? So his is basically a 9-month protocol. So with NutriMedics, they have a box of month 1, then month 2, then month 3, and they have an app that goes along with that tells you when you need to take stuff. It tends to be a bit complex, and the company's in the process now of simplifying it, so it's a lot less stuff to take and less frequent, because it was just overwhelming for so many people. But that was sort of the initial approach, is that if you keep changing the protocol every month, the organism never really gets used to the same thing. You're addressing different parts of the illness, and that's the way he's been doing it for quite some time. So when I first learned about it and kind of went through, I'm like, wow, this is really hard for people. So I started doing the research, and I looked at what Dr. Shoppe had done in her research. I'm like, wow, it seems like that there's just a handful of these organisms that do the heavy lifting. So why don't we just narrow it down to that? So For acute Lyme disease, I said, why don't we just do like Cemento, Banderol, Kumanda? That's what the research was based off of. We can get 15 to 30 drops twice a day. We could add berber if there's a lot of herpsing. And for children, again, we could start at a smaller dose and titrate up, really depending on body weight and how people tolerate it. So with acute Lyme disease, you kind of want to go in at a high dose and treat it for at least 30 days. And depending on response, we may continue longer. So all the treatment's really based on clinical response. There's no set that you've got to take it for X. 30 to 45 days, I think, is pretty common. And if we need to go longer, we will, really based on how people feel. If it's chronic Lyme disease and we want to use the same herbs, well, I want to start very slowly. For whatever reason, if we go in at a high dose for people who've had this for a while, they do tend to get herxing. They feel terrible. I don't think this is something where you have to get worse to get better. So I'll start with 1 or 2 drops twice a day, and then every 2 to 3 days, 3 to 4 days, go up by 1 drop twice a day, up to 30 drops twice a day for an adult. So the only reason to go up is you don't feel any difference in the way that you feel. And if you get to a point where you do feel better, then stay right there. I have some people that get to 4 or 5 drops twice a day. They feel like their energy is better, the joint pain's going down. Great, stay there. You don't have to go any further. So I like the ability of being able to really find the right dose for you, what you feel best at. And again, there's no set dose that you have to be at, but I find if we get to 30 drops twice a day and there's no improvement, we're barking up the wrong tree and we need to do a different protocol. So the advantages of the Cowden Protocol: relatively easy to administer, clinically beneficial, I think reasonably cost effective if we do kind of the modified version of it versus the whole one. Herx reactions can happen. It is a long-term treatment, although I can say that really for all of these. And it does require multiple bottles and dosing, so it tends to be a little bit labor intensive. Sometimes people have 3, 4, 5 different tinctures, and when you're doing 30 drops twice a day, just counting out 30 drops twice a day is kind of annoying for people. But in the grand scheme of life, it's really not. I'd say that disadvantage is relatively minor.